Well, the King's diagnosis is far from unusual. 1 in 2 people in the UK will develop some sort of cancer in their lifetime. Now, more than 336,000 people received treatment for cancer between December 2022 and November 2023. That's around 1,000 people per day, and it is the highest on record. And if you look at the number of urgent cancer referrals each month on this chart, there's been this huge surge all the way back from 2010 to where we are today with that dip in the pandemic. In fact, it has more than tripled, and that's good news because it increases the chances of catching cancer earlier and thus saving lives. But it does put pressure on the diagnostic system when the majority of referrals are not actually going to be cancer. So when it comes to that diagnosis and the treatment, in the UK, the 4 most common types of cancer are prostate cancer, breast cancer, lung cancer, and bowel cancer. Now, age and gender are actually a huge factor here. And so this is what it looks like for male patients over 75 and over. That's the same age as the King. And you can see these are the various risks. Prostate is the biggest cause. Now, we do know that isn't the cancer that Charles has, but it is the most common. Then you have lung, bowel, colon, and bladder. Now, some of these have different survival rates. Lung cancer, that is particularly grim, but bowel, colon, and bladder, they're a bit more optimistic. And we know the King will be receiving the best care. And that's important too, because one of the things affecting survival is deprivation. People from the most deprived areas simply do not live as long as those from the wealthiest, even if they have the same disease. Take bladder cancer down here. You can see that nearly 6 in 10 in the least deprived areas, the most wealthy, they live for another 4 years. But even in the least deprived, that is less than half. So with his cancer diagnosis, the King is going through something that half his subjects will also deal with. But his subjects experience this in very different ways, depending on where they live, how long they have to wait for referral, diagnosis, and treatment.